Occasionally, I'll have a patient come in that has a pristine, beautiful smile. The teeth are lined up perfectly. They're just not the whitest color that the patient would like to be. And so we start talking about veneers. Veneers are more like fake fingernails for teeth. A porcelain veneer is probably the only procedure, or one of the only procedures within dentistry, that is more of a want versus a need. A patient can come in and say, I need 6 veneers. What they're really saying is, I really want my teeth to look whiter and straighter. So it's more of a desired outcome of how those teeth are going to look at the end. When we get a patient that's interested in veneers, first I usually recommend bleaching or whitening. But the reason why I do that is usually with whitening, which is totally non-invasive. We don't really touch the teeth from the standpoint of shaping them differently. By doing that, we might get them to where they need to be. In some cases, whitening helps us to get veneers where they need to be so that the teeth are a little whiter when we start. Therefore, we can get a better shade situation. We can do veneers by themselves. We can do combination of veneers and crowns and make them look the same. And the reason why I say that is I recently had a patient who wanted what was called non-preparation veneers. They just make veneers and put them on your teeth. But what we're finding is when we do non-prep veneers, we're kind of stuck on the shape of the tooth as it is right now, and you can only build so much into the porcelain of the veneer. Sometimes the patient says, well, I really don't want a crown. I don't want that tooth that much reduction. But really, when you sit down and have a conversation with them, it's not something that they ever want to go back on. They don't want to ever go back and change to what they were before. They want to stay with the new whiter color. So whether it's a crown or a veneer, as long as they understand why, it works best that way. With veneers, we can work on shape. We talk about shade. What color do you want your teeth? What do you want them to look like? That if they want just the front 4 teeth or the front 2 teeth done with veneers, I say we can do that, but that's very difficult to make that knot stand out. So I'm an advocate for either doing 4 or 8. And the reason being, if we do 6 and we kind of end it at the cuspids or the eye teeth, that kind of makes them stand out and pop out. If we round the corner, they blend in. And anytime we do cosmetic work, really anytime we do a crown, we include the shade choosing with the patient. We give them the shade guides, place them in their mouth, show them what the shade would look like, and recommend a different shade. And we communicate that to the lab so that when the veneers come back, they fit that criteria that the patient is hoping to see. Sometimes we have patients that want to go all white, Hollywood white, and others just a little bit better looking teeth. So we need to include them into it. Usually with prep veneers, we do send them home with temporaries. Well, veneer maintenance is very similar to crown maintenance. And a lot of that just has to do with good oral hygiene and how well they take care of their teeth at home, but also coming into the office for their 6-month checkup so that we can make sure there's no decay around the veneers or make sure they're cleaning properly around the veneers. Well, I think when a patient calls and they've lost a veneer or they've lost a crown and it's affecting their smile, we do our best to get them in as quickly as possible. So if they call in the morning, we'll have it done probably by that day if their schedule allows. And so anytime we can take care of a patient and ease their concerns, frustrations, or discomfort about the way they look, we get them in as quick as possible. The last thing I ever want to do is ignore the things I know about teeth and smiles and how teeth fit together and just do always what the patient wants. We want to do what the patient wants, but it's got to be within the guidelines of what I've been taught.